Energy drinks are in the news and they're under fire. We're talking via Skype with Dr. Scott Shapiro. What is your take on energy drinks? Can they be dangerous?
With the emergence of these drinks, especially in teenagers and young adults, caffeine consumption is clearly on the rise, and these are drinks that are not regulated by the FDA. And so we're seeing more and more ER visits for just this, caffeine toxicity.
What is caffeine toxicity? What are the symptoms? When do people come to the emergency room because they're experiencing problems?
So in low doses, your cup of coffee in the morning, caffeine can make you more alert. We've all experienced that. However, in doses greater than 250 milligrams, patients can become a little anxious, a little restless, and in very high doses, even confused or have seizures. From a cardiac perspective, patients can have tachycardia or other types of arrhythmia. Chest pain is not uncommon, especially in patients with underlying cardiac conditions. From a GI perspective, patients can have nausea or vomiting or abdominal discomfort. So caffeine in very high doses can have a very negative impact on patients.
But do you see it from their drinking coffee or soda, or do you see it from them drinking these high energy drinks?
Well, so compared to Coca-Cola, these energy drinks may have 5 or 6 times the amount of caffeine as a 12-ounce can of soda. Similarly, a cup of coffee may have 80 milligrams of caffeine in a 12-ounce cup of coffee compared to 250 or so milligrams of caffeine in one of these energy drinks. So you can see that these drinks, because they're not regulated by the FDA, can contain much higher doses. And if you have a young person who is low body weight consuming 2 of these energy drinks, you can imagine a very high dose of caffeine consumption. Now, the issue is further complicated by young people mixing these beverages with alcohol. And so the combination of things can be potentially very dangerous.
Is it because they mix it with alcohol so they drink more? They mix it with alcohol, they forget how much they drink? Is it all the above? Is that the problem with mixing it with alcohol?
Yeah, so all of the above. Caffeine, as we've discussed already, is a stimulant, and so it can counteract some of the depressive effects of alcohol. And so when you combine the two, people who may have had too much to drink have some of those symptoms masked by the stimulation effects of the caffeine. And so people who wouldn't drive drunk normally may feel that they're okay to drive, or they may not realize how drunk they are because they've combined the 2 substances together. And we see this in the amount of emergency room visits, which is clearly on the rise in young patients who are in their upper teens and early 20s.
I think Bloomberg reports that it's a tenfold increase from 2005 to 2009. So they actually come into the emergency room and they say what, their heart's fluttering or they can't concentrate, or I mean, what is it they're coming to the emergency room with?
Well, it depends. Now, obviously, if they've consumed a lot of different substances, they can be coming in with a myriad of symptoms. But if from a caffeine perspective, yeah, a lot of these patients have arrhythmias. They have tachycardias. They feel that their heart's beating out of their chest. And some of them may have actually pathological arrhythmias. So the caffeine can trigger it or set it off, some underlying substrate that they already have. And so patients will come with that. Rarely they could come in with a seizure, or perhaps they'll come in with intractable nausea and vomiting. So you could see a lot of different non-specific symptoms that if you didn't know the patient was consuming these drinks in high volumes, you wouldn't know exactly what the cause of it was.
I think one of the big concerns is the fact that you might have an underlying condition. What might those be, and how should that affect having an energy drink?
So young people can have a propensity for arrhythmias. They could have some underlying structural heart disease that is gone undetected. And when they consume a substance that has 6 times the amount of caffeine as a Coca-Cola, or if they have 2 of these drinks and have greater than 10 times the amount of caffeine in a regular soda, you're asking for trouble. You're really putting your heart in a position where you can trigger these underlying conditions. And while I don't think drinks are going to affect the average person if they have one of them, I think young people who are taking too much of this drink with caffeine, mixing it with other substances, and may have underlying conditions, are putting themselves in a life-threatening situation potentially. And I think we've seen this in a couple of situations possibly across the country.
What rule of thumb should people go by? Should parents tell their kids? Should adults who like these drinks think about before consuming a second or a third one?
You know, Mark, as we get older, we learn that moderation is one of the keys to life, no matter what behaviors we do. And so I would advise extreme caution. And if they're going to partake in some of these drinks, they need to do it in extreme moderation, because young people can be clearly affected, especially when they mix these substances.